Hi students, myself Miss Vincy Mary Wilson, Assistant Professor, Dr. Vittal Rao Vikke Patel Foundation, College of Nursing, Ahilya. Today we are going to discuss regarding an important aspects in childhood nursing, that is care of under 5 children, that is under 5 clinic. Next slide, we will go in detail regarding under 5 clinic. So we will go in detail regarding the content. Introduction. Childhood is a period of rapid growth and development. Children of under 5 years require special health care. Do you know what is under 5? The children which are coming below 5 years of age are called as under 5. So, under 5 clinic has been developed in the recent years in place of earlier Well Baby Clinic, which was formed by Professor David Morley in 1963. Now, under 5 clinic. Children of under 5 age constitute of 15 to 20% of population in developing countries like India, and in that 35 to 60% of the all death occurs in this particular age group, that is under 5. The major cause of that particular death is diarrheal disease, malnutrition. It can be protein allergy malnutrition or cash worker marasmus. Then in acute infections like upper respiratory tract infection, lower respiratory tract infection, meningitis, encephalitis, etc. etc. Even it can be common cold also. Now moving to aims and objectives of under 5 clinic. The aims and objectives of under 5 clinics are set out in a symbol or emblem which has been proposed for the under 5 clinics in India. So it includes care in illness, preventive care and growth monitoring. Along with that, two main aspects are also coming, that is health education and family planning. We will go in detail. The under 5 clinics offers the best combination of preventive, curative and promotive care service. The clinic is run in association with antenatal clinic. You know what is antenatal period? The period during the pregnancy or before delivery is called as antenatal period. So it's run along with antenatal clinic. Now symbol of under 5 clinic. Here many triangles you can see. An outer lining triangle which denotes health education. The inner lining triangle with inside that there is an inverted triangle which denotes red in color. It is family planning. And at the apex of the triangle you can see care in illness, and at the right side growth monitoring, and at the left side preventive care. So we will go in detail regarding these components. So components of under 5 clinic. First component is care in illness, then preventive care, growth monitoring, family planning and health education. So next we will deal on the first aspect, that is care in illness. Care in illness. The apex of the symbol represents care and treatment of the sick child. Sick child means the child which is suffering from acute illness, chronic illness, then congenital disabilities, other congenital problems and etc. This is the mother's felt need. Felt need means the mothers feel that this is the important aspect, that is early detection and treatment of their child sickness and prevention of particular illness like 6 killer diseases. That can be done through vaccination. We will go detail in immunization regarding that. Then 70 to 90% of care of sick children can be handled by trained nurses like us. The basic philosophy of the under 5 clinic is to give nurses effective training and responsibility for handling the child health care services. So we are the primary workers or primary level workers. So the education and training should be given to us, and it's our responsibility to educate the family and the society. The illness care for children with comprise then diagnosis and treatment of acute illness, chronic illness including physical, mental, congenital and acquired abnormalities. Then you know what is acute illness? Like before I mentioned, upper respiratory tract infections, okay, lower respiratory tract infections like pneumonia, asthma. Then chronic illnesses like sometimes congenital diseases like ASG, VSG. Then disorders of growth and development like ADHD. then learning disabilities, like that. X-ray and laboratory services and referral services. Second component is preventive care includes immunization, nutrition surveillance, health checkups, oral rehydration, family planning and health education. So we will go in detail regarding each aspect. Immunization. It is the birthright of any child. So from the birth, we will give immunization to the child. From the birth means we will start from the BCG. Okay, and in the immunization schedule, it has been mentioned like in each age group. Okay, in each month we should provide immunization for the child. The main goal is to immunize all children against 6 killer diseases. I think you know what are the 6 killer diseases: diphtheria, whooping cough, tetanus, polio, tuberculosis, and measles. So the baby should be vaccinated at proper age and proper time. Second aspect is nutritional surveillance. Almost all the major nutrition disorders like protein energy malnutrition, anemia, rickets, and nutritional blindness occurs in this particular age group, that is below 5. Nutritional surveillance is extremely important for identifying subclinical nutritional problems like what we mentioned before. Food supplements or on-site feeding are often an integral part of intervention strategies. So the ICDS in India has taken and supplementary feeding of children below 6 years, like etc. Complementary feeding, midday meal feeding, etc. This has been done along with ICDS under 5 clinic. Health checkups. The health checkups cover physical examination and appropriate laboratory test. These checkups are provided every 3 to 6 months in the sub-centers or other primary health centers. The child health card that we used to follow, that's under 5 clinic used to follow ICDS projects health card, provides a checklist for this examination. Means in that checklist they will be mentioning what all the things has to be monitored. The main purpose is to identify the high risk cases. Then fourth aspect, oral rehydration, ORS therapy. You know, in which case we used to provide ORS in case of dehydration, especially due to diarrhea. On an average, the child living in a poor community in the developing world will be suffering with an attack of diarrheal infection between 2 to 6 times per year. So the mother are taught oral rehydration therapy in case of the child has diarrhea. The mother will be getting training from the particular centers or trained nurses when to give ORS and how to prepare ORS. Family planning. In the center of the symbol is a triangular area which is colored red, stands for family planning. Family planning is an important component of the child welfare. The mother, it is possible to conduct family planning programs successfully through these clinics. Then the fifth aspect, that is health education. Around the wall symbol is a border that touches all the other areas. This represents health education which the mother automatically receives. She is told how to keep the child clean, how and what to feed, and when she should bring the child for immunization. An immunization card also will be given to the mother so that she can note the time properly. Then growth monitoring. One of the basic activities of the under 5 clinics is growth monitoring. That is monitoring the height and weight of the child. So there are particular interval for according to the age group. That is monthly interval during the first year. Means each month the child should be taken to the primary health center or the clinic to check the growth and development. Then every 2 months during the second year. In the second year, monthly 2 months wise, once we have to take our child to the primary health center or nearby clinic. Then every 3 months thereafter up to the age of 6 years. Means 3 months, in every 3 months once we have to take the child for growth monitoring. Now this is growth chart. The child's weight is plotted on the growth chart that we used to say as road to health card. The curve that is obtained is known as growth curve. This is maintained for boys and girls separately. In this growth card, we can see the height and weight of the child, and we will be plotting according to the month of the baby. It will be helping us to identify if there is any malnutrition or any nutritional deficiencies. Now, role of nurse, final aspect of this content, that is, what is the role of nurse? Identify risk cases in the community. It's the responsibility of the nurse to identify which all the children who are under 5 is having risk cases. Then educating the public, not only encouraging but also undertaking research studies herself by the nurse itself. Then providing holistic nursing care, means complete nursing care. It includes prevention, promotion and curative aspect. Then lobbying for the child's right. Then be a role model for them in the care provided. We are concluding to the topic. The under 5 clinics combines the concepts of prevention, treatment, health supervision, nutritional surveillance and education by comprehensive health care within the resources available in the country, making use of non-professional auxiliaries, thus making the service not only economical but also available to the larger population of under 5 children in the community. Thank you.